right, welcome everyone. We're here today to do an update on COVID-19, and thanks for coming. And we're doing this live on Facebook as well as over Zoom as a webinar. We do these every 2 weeks typically. Trying to give everyone an update on the most relevant topics, so you don't have to focus on all the news that's coming at you. And the hope is that you can actually simply get an update here, which will give you some of the more refined aspects of what's going on out there in the world. So let me go ahead and share some of my slides so you guys can get a sense for what we're talking about. Great. So again, we'll do this every few weeks. Today we're going to talk about trends and epidemiology of what's going on, some of the use of masks and how people are using masks and their effect. People have been concerned about what are my chances of getting COVID, and if I do get it, what's the chance of me surviving? And we'll go through some of that. There's some good resources for that. Most recently, there's a lot of concern around the long-term effects of COVID. Once you've supposedly survived it, even if you had mild symptoms, there's concerns about long-term effects lingering. And of course, I always want to remind everyone to spend time taking care of themselves during this time, since it's such a time filled with emotion and a lot going on with respect to what's going on in our politics, what's going on in the social justice and equity movements, as well as COVID as a pandemic, on top of the underbelly of climate change. It's an ongoing factor for us. So let me give you a little summary here. This is a daily new confirmed COVID cases map. So this looks at the world and looks at how many people are getting infected by country on a rolling 7-day average. And what you can see is that what you'll find here, the darker colors are the areas where there's the higher number of cases. So United States sticks out like a huge red light there. You can see the United States, you can see Brazil and South America, you can see India, and you can see South Africa as the ones that are really the high points. Interestingly, you can see then Central America, South America, and Mexico also on the next level of intensity. That is worth noting as well. If you look at it not only from this perspective, but you can also look at it from sort of a graphic perspective. This is a log graph. So on the left-hand side is logarithmic. So the changes don't look as big as they really are. And I'll show you another graph to depict that. But you can see here over time, since the onset of each country's infection rate starting. So in other words, days since confirmed cases first reached 30 per day. So just the onset of the epidemic in their country rolling forward over time. You can see, unfortunately, we at the United States of America win the prize for the highest number of cases day after day after day, and still to this moment in time. You can look at other countries such as Norway and New Zealand and South Korea and Russia, which you can't see here, but you'll see in another graph, that clearly have done much better, and their caseload has dropped over time. Right now, United States, and then if you look at Brazil and South Africa and Mexico are really the top four. And you can see by color the percent positive rates. So we, unfortunately, in really the top four countries I just mentioned are really the top positive percentage rates. You can see that by color in the orange and red. Another way to look at this, if I just pull out a few different countries, namely Sweden, United Kingdom, Russia, and the United States. This is a linear graph, not logarithmic. So these are actual case numbers. You can see we're around 65,000 cases daily right now. You can see how we've rolled through this from March rolling forward. And all of a sudden, boom, as soon as we reopened, thanks to President Trump's lack of leadership and his decision to really delegate at a state level and allow governors to sue their own mayors city by city, creating chaos and havoc throughout the United States. You can see a huge skyrise and skyrocketing in the number of cases. Now, if you look at Russia, which is declining, you can look at Sweden that barely even makes it up on the map, as well as the United Kingdom are doing so much better. Another way to look at this is really, and here's looking at death rates. And you can see right now, unfortunately, South and Central America are comprising a huge proportion of the death rates, with Latin America now accounting for 44% of death rates. That's actually excluding Brazil and Mexico. So you can see there's a huge amount here coming from South and Central America. And you can see the United States, the gap is widening again, or I should say the number of deaths is increasing again. And that's spreading over time, as you can see, as well as India being a big piece of it, of this puzzle as well. I really want to hone in on the Johns Hopkins data just to really hone in. There's over 16 million confirmed cases at this point, over 500,000 deaths, somewhere, 2/3 of a million at this point, with the United States leading far and far away, and will continue to lead, unfortunately, in the near term. United States, interestingly now, you can see here at a close-up of the United States where the caseload is, with a huge amount going across the Sun Belt. You have Florida, you have Georgia, you have Texas, all Republican governors, all opposed to the local mayors that were trying to do the right thing in their respective cities. Many of them suing their mayors because they're against school reopenings and against trying to do a lockdown at the city level, and all of them in line with Trump's approach, which has been to not wear masks and to reopen as if this is the seasonal flu. So now we see, unfortunately, a lot of suffering and a lot of illness going on. In both Georgia and in Texas, their ICU beds are actually nearing capacity at this point, and there's deep concern about this dramatic rise. Bringing it back home here into California, this is a comparison of 2 weeks ago when we presented this data on the left-hand side compared to the right-hand side, how we've made some progress. So thankfully in California, we've really started to try and get a better handle, both in San Quentin, which was a huge part of the Bay Area's increase in that prison, where over 60% of the inmates were positive, unfortunately. As well as Imperial City and near the southern border of Mexico, where there was huge traffic going across the border from Mexico into the United States, as well as Mexicans leaving the United States and going into Mexico who were sick as well, but bidirectionally. You can see on the right-hand side an improvement. So that's great to see. Number of cases are starting to drop. They flattened and are starting to drop. You can see there on the right-hand side compared to 2 weeks ago, which is on the left-hand side. Unfortunately, of course, deaths always trail behind cases by at least a month. So there's an uptick now at this point in the number of deaths. And that's representative of what we saw 2, 3, 4 weeks ago of the uptick in the number of cases. If you could look at the Bay Area, things are improving as well. It's nice to see. You can see a drop on the upper right-hand corner of the number of cases. Number of deaths are somewhat flat at this point, but the number of cases. And if you look county by county, Alameda's done a great job, dropping by almost half. San Francisco dropping by 2/3 the number of cases. And then Santa Clara County flat. Marin County dropping by 28%. Napa is a bit on the rise. They're pretty open right now. They have a lot of commerce. A lot of restaurants are open, a lot of wineries. A lot of businesses really opened up. Sonoma and Napa County both. So there still is a large increase. The predominant number of cases really in California in particular, about 80% are comprised of the Latinx community, and that relates to the fact that they predominantly are not able to work from home. and that they have a high number of household members within their home. So the infection rate is increased because of that. They have to often take public transportation to get to work. And if they're at work, they may be doing work, the type of work that where they're in close proximity with others, and then they come home to an environment where other people are doing the same thing. And so the chance of getting infected is a lot higher. The other community is the 20 to 40-year-old community, and that particularly is true nationally as well. The 20 to 40-year-olds are, because they have sort of really taken it upon themselves to feel like they're immortal, that they're not really concerned about the infections that they may carry to other people. And so they've gone back into circulation. And now a lot of the ICU beds are actually filled with folks in the 20 to 40-year-old age range. So those are the two large demographics. And of course, I mentioned the prison system as well. So in California in particular. So now I'd like to sort of shift gears. That's a quick overview of the statistics. The good news is that locally within California and particularly within the Bay Area, things are starting to have a downward trend. Really exciting to see that. And that much of that is related to what I want to talk about next was the use of masks. And what does it mean to wear a mask? So there's different types of masks that you can wear. So, you may start with a mask that is a N95 mask, which a lot of people are trying to get, or KN95 masks. Those are able to filter at least 88 and 98% of all virions that would come through that filtering apparatus, and that particularly of an aerosol nature, which is the very small size, less than 1 or approximately, let's say 1 to 2 nanometers. Then you have the next level down, which is surgical masks that are typically 3-layer masks, and those also do a very good job, particularly for respiratory droplets. Then you have homemade masks, right? They may be made of cloth, they may have a coffee filter inside of it, or other sorts of filtering agents that are embedded within the masks, or nowadays you can purchase these masks as well that are made of a range of different garments. And what's interesting is N95s, even in the hospital environment now, are really not being used unless it's for procedures, because we don't think this organism is transmitted through aerosol. Thank God, unlike tuberculosis, for example. Folks with tuberculosis go in the hospital, they're in a negative pressure room where the air is sucked out of the room, because these very fine small particles can just stay in the air and you can breathe in, and doesn't take much for that tuberculosis to set root in our bodies. Thankfully, this is not primarily aerosol transmission. And the way we know that is, at this point, there would be hundreds of millions, an order of 1 billion or 2 billion people infected at this point if it were transmitted through aerosol. When we're doing hospital procedures, there is a risk for aerosolizing the viral particles. Either, let's say we're doing a bronchoscopy or we're doing a colonoscopy. These are the procedures where things come out in the air. And so we wear N95 masks. But for general community use, you don't need them. So that's good news. So what can you use? Surgical masks and homemade masks. Now, surgical masks are more effective than homemade masks, but homemade masks are somewhere between 50 to 90% as effective as a surgical mask. So, so there's a range of different studies that have gone out to look at this specific issue. They've looked at it for different viruses. There haven't been any done specifically for COVID-2, but they have been done for SARS, they have been done for influenza, for respiratory syncytial virus. And so we've taken a lot of that data to correlate, to look at this particular situation. And what do we know? If you take a conservative outlook, there's a group that did, that's related to the British Medical Journal editorial board, and they produced an article which I list. I'll show you here, which I list here. It is a pre-release, so it hasn't been peer-reviewed yet, but the authorship is quite reputable and well known to the medical community. What they did is they took some data. They say, okay, we know the R naught, meaning we know the infectious rate on average of this virus in an uncontrolled environment. It's 2.4. I get infected, I'll infect 2.4 people on average. So what happens if we wear a mask? Let's say 50% of the population wears a mask. Let's say 80% of the population wears a mask. And then let's assume how effective is the mask. So conservatively, let's say it's 50% effective. And primarily it's source control. And what I mean by that is its greatest effect these masks have is if I'm infected and I don't know it, I may be asymptomatic, or I may have a mild case and think it's the cold, and I'm wearing a mask, I will protect the community around me. That's the main sort of part of how this is so effective. There is some benefit from others that infecting me, but the biggest benefit is this mask prevents me from affecting others. So with those assumptions and understanding that sort of context, the model showed 50% mask use across the population. We can take that reproductive value and cut it in half. We can go down to 1.35, which is really equivalent to the seasonal flu in its infectiousness. And if you go to 80% of the population wearing masks, which you can see in different communities, depending on the community you're in, with the same efficacy, you actually drop it below 1, which means that you will end the epidemic. The epidemic, it will end. So had Trump not created all these mixed messages about masks, this epidemic would be over in the United States. But unfortunately, due to his politics, he chose not to do that path. And here we are with people dying, unfortunately. So if you look at what does the math look like? So take this scenario of uncontrolled, unregulated, R naught at 2.4. At day 1, you have 100 cases. A month later, you have 31,000 cases. That's how quickly it replicates. Since every single case creates 2.4 cases, and then it keeps doubling every 4 to 7 days, you end up with 31,000 cases at the end of the month. If you simply do the conservative approach of cutting it in almost half, not even half, of an R naught of 1.35, from 100 cases, you only end up with 584 cases at the end of the month. Look at that dramatic shift. And what does that mean? Well, 580 cases over a month, you could do the contact tracing that you need to do in a community to talk to those cases, find out who they were with, quarantine those people or get them tested, get them to wear masks, et cetera, et cetera. And then you could end that epidemic at the local community level. So pretty amazing. This paper was great. It went on and showed this is a bit more complicated. And what this is really at different levels of adherence in the community on the vertical axis and different levels of effectiveness of the mask on the horizontal axis, you can figure out how much you can reduce the R naught, how much. And basically what you see here is if you have 80% of the population wearing the mask and you come across here to moving across towards the right into the blue zone as it gets darker with assume 60% effectiveness or even 50% effectiveness, you go below 1 quickly. So even with 50% effectiveness, once you have 80% of the population wearing their masks, this epidemic ends. It's over. It's done. And we won't sit here having hundreds of thousands of people dying. So again, universal mask use is the clear solution, and anyone who feels otherwise is just not understanding the science. So I wanted to switch gears a little bit and talk a bit about surviving this. What does it mean? What are my chances of catching it? If I do catch it, how likely am I to survive? So there are people that are clearly ill right now in the hospital, and what's their chance of survival? And I've had many patients approach me and say, you know, how risky is this? What's the chances of me getting it? And what's the chances of me surviving from it? So let me show you a couple things that might sort of provide a little bit of input. There is no sort of well accepted and known risk calculator out there. A lot of them are really about they're focused on primarily research. And so what I'm going to show you right now is that there's a few different ones here. The one I like is this one called the COVID-19 Survival Calculator. So let me show that to you. And this is, what I did is I actually did this on myself. Most recently, I've been a little bit more social than normal. I have 4 people in my home, and I went to a few other people's homes and was outdoor with them. So that brought up my estimate of catching COVID-19, because I did this once before and it was around 1 or 2%. And now the estimate goes up to 5%. On average, it's 11%. And I'll show you some of the questions that they asked to get to this answer. It says I'm in the lowest risk band for catching it. And then it says, what's my chance of dying? So if infected, we estimate you have a 0.5% chance of dying. The average is 0.38. So I'm in the highest risk band for dying. And I presume the primary driver for this is my age, since most of the other factors, I'm healthy and really don't have any other drivers that would increase my risk. If I were to show you, then the next question is, well, we know my infection risk is 5%. So we just talked about that here. That's on the left-hand side, infection risk. We know my mortality risk is 0.5%. If I were to get it, what's my overall survivability of this? Meaning that if you take these two combined, what do I end up with? So overall, my chances of surviving this pandemic right now are 99.972%, pretty phenomenal. So that was the most surprising and impressive piece for me, in my view, of what was sort of most interesting about doing this exercise. What I'd like to show you is another piece of this. So let me just switch this for you for a moment. And sort of show you some of the, see if I can put this away. And I can show you the actual questions that were asked, which are, I find quite interesting. So you can see here some of the questions that are asked. So what's your gender? How old are you? What's your body habitus? What's your blood type? As you know, some of you know, there's one paper that's found that blood type may be associated with COVID risk. So if your blood type's A, the thought is there's an increased risk of disability from being infected, and blood type O is a decreased risk, it's somewhat protective. They then ask sort of your, income for your country, some other things that I think they're doing research around, race, where you're born, do you smoke, do you drink alcohol, what are your medicines, some of the environmental factors as well. Are you traveling, using public transportation? That will increase your risk. Do you travel or work to school? Because that increases your risk. The number of contacts you've had as well, so that you're in close contact with. And then they go on and ask a few other questions on the right-hand side here. Behavioral factors, how worried you are. Again, some of this is research. I'm taking steps to reduce my risk by social distancing. That is known fact to improve our health, right? Washing hands. And the people I live with, are they doing the same thing? Social distancing, washing hands, using alcohol and hand sanitizer. And are you wearing a mask? And then some conversation questions that are more research oriented around our opinions around governmental factors. Then the other question is around underlying health issues. And then based on all that, you click the calculate button and you get your answer. What the backbone of this is that infection rate adjustment factors are as the following. So if you have symptoms, obviously it dramatically increases your risk. If you're in a nursing home, it dramatically increases your risk. So this is sort of the backbone that's driving the calculations. And you can see that what everyone's been so worried about, heart disease, kidney disease, liver disease, lung disease, you can see how much it increases your risk here for any infection rate adjustment factors. And then if your contact person count, as it goes up above 9, or house person count above 10, that can dramatically increase your risk as well. If you're a healthcare worker like I am, our increased risk goes up by 24%. So again, age is a big driver. So you can see here, 50 to 60 is considered 1, and then 60 to 70-year-olds, it goes up dramatically as we go up by decade. I'm in the 50 to 60 group, so therefore I think the reason my risk went up is because of the number of contacts that I had. Looking at this as 1. Again, looking at your BMI, if you're morbidly obese, it increased by 56%, even higher, doubles your risk. 30 to 35 is considered obesity, And again, that your increased risk is by 27%, 56%, and over double here. Males are at increased risk over females, and other health factors that we have here. Looking at this is at mortality risks now. So as you can see here, so this is really sort of the backbone of how this is engineered. So you're welcome to have a play with it. It's called COVID-19 Survivor Calculator, and I think it might be worth people's time to play around with it. It actually, once you do the survival probability, you actually feel a lot more, for the most people, they feel really a lot more comfortable with their own personal risk. So back to looking at our survivability for me, and again, 99.97% is quite reassuring. So shifting gears a little bit, I wanted to focus on a new unfortunate realization that's coming to sort of the researchers' mind, as a lot of people are coming forward and saying, I've been sick, and I'm better now, I'm no longer infected, but now I'm having these complications that seeming to linger. A lot of people are saying that their experience is similar to chronic fatigue, where a lot of people are really not feeling like they have very much energy, not being able to focus well, and several other problems. So as you can see here, the National Institute of Allergy and Infectious Diseases started a longitudinal study looking at sequelae, which really means complications, and looking at an immune response to people that have been infected with COVID, and to look at this for on the long term. And as a sort of the MedPage news article says on the top, even people with mild cases have been having this persistent fatigue, trouble breathing, and really a lot of unexpected issues. And it's unclear why. Some people are concerned about the thrombotic effects that are happening, so that some of the major problems they find are people having in their heart and in their liver and in their peripheral system and in their brain, is that the prothrombotic effects from COVID-19 that we're seeing are causing these problems, is one of the main theories. Imagine that in your brain, if you have multiple small thrombotic events, which means small little blood clots in the small little being deposited in the small arterial systems or venous systems within the brain, but that could then lead to, in essence, mini strokes. So the thinking is maybe that's part of the problem. It's a bit unclear. Is there ongoing chronic inflammation? That's part of the problem as well. So there's a lot of research now that's going to unfortunately need to happen, because unfortunately so many people are suffering. A lot of people in particular that had mild cases are saying they don't have the same exercise exertions that they used to have. It's been 3 months already that they sort of, their symptoms went away, but they exert themselves and they're exhausted. Or while they're exerting themselves, they're completely short of breath. So these are some significant issues and things to look out for. So, on the prevention side, just to sort of go back to thinking about, well, what can we do for ourselves? How can we reduce our risk? And so, I'd like to always show this slide at the end of sort of what we're talking about with respect to COVID, because it really has to do with how can we help ourselves. There's so many paths to choose right now. There's so many ways we can choose to live our life. Knowing that this is going to be for the next duration, call it 6 months, call it 12 months, maybe 18 months, in this current place that we're in right now, which is sort of this modified reality that we've been used to. How do we care for ourselves? And what you may be experiencing, and I know many are seeing all the patients and as well as friends at large, is that people are diverging. Some people have never been more fit. They've never been more sort of in touch with nature. They've never had such quality time with their family. And others are the exact opposite, where they're not able to exercise. They're feeling more depressed. They're gaining more weight. And so these divergent paths are starting to emerge. And what do we know? What do we know? We know that if we care for ourselves, that will do much better. Our quality of life will improve, and our risk of getting infected is reduced, as well as our risk of becoming quite ill or dying or needing to be hospitalized is reduced. So what does that look like? There's a couple different pieces of the puzzle. So one is self-care, which I speak to a lot. And if we can just be kind to ourselves, first of all, if we're not caring for ourselves as well as we could be, just be kind to yourself and not beat yourself up over it, because of course that then leads to self-ridicule, judgment, anger, and then you just beat yourself up and go nowhere. So to find that middle path of really giving yourself permission to understand that you're suffering. Many of us are suffering right now. And just to do a little bit every day, to commit to 5 minutes of activity every day, or 5 minutes of meditation. Just one little drop, one little penny in the bank account day after day, and you'll start to see yourself bending towards the right direction. So I encourage you to do that. The other piece is just interacting socially. For a lot of us that are extroverts, me included, I enjoy being with others. And so that's a hard part of this journey. For many introverts, they love this because now they don't have to apologize for the fact that they like spending less time with other people and they feel more energized. But many of us get energy from other people. So how do you modify that? And I thank God it's summer and we can spend time outdoors. So I encourage you to socialize in a way that's socially distanced, and to use masks. There's a lot of research right now looking at masks that even if you do get infected, we think it's a lot milder because the viral burden that initially hits us is dramatically reduced by wearing the mask, by being socially distanced. And so that since that viral load is much reduced, people either don't get sick or they have much milder symptoms because our body's able to actually manage it better. So again, sort of practical things that are low tech. You don't need a vaccine. You don't need a cure for this immediately. We just need to avoid getting it in the first place. And if we do get it, have a much lower burden. So I really encourage you to engage in all these sorts of activities and be thoughtful and be kind to yourself as well as others as we walk our way through this journey together. I'd like to spend a few moments. There's been a few questions posed, so let me address some of those. One question asked was, can you clean surgical masks? And most of them are not designed to be cleaned. So there are surgical masks in particular. What you can do is use the mask and then hang it up for 4 days, and then it becomes reusable again because the virus has died. Now, if the surgical mask has become spoiled, maybe it's got makeup on it or lipstick or it has dirt, then I would toss it and use a different mask. You can buy these masks now. I know Walgreens, for example, they're 50 cents a mask. You buy them in bulk, for 50 of them, it costs you $25. And you can reuse those masks a lot. So it becomes affordable using those surgical masks. There are other masks that are homemade masks or ones that you can purchase, out in the marketplace that are made from cloth. And there's all sorts of things being made out there. So you may have seen these. Some of them say that they have N95 filtering. Whether that's true or not, it's hard to know. Some of them are NIOSH approved, rarely, but they are. Other ones have some sort of filter within the cloth, and they are reusable, that you can wash some of them. Some of them have antiviral sort of embedded chemicals in them, supposedly. Some of them heat up now and supposedly kill the virus. Whether that's true or not, it's really hard to know because a lot of these are commercially made and not well studied. But any mask, again, is better than none by far. By logarithmically, it's a huge difference. So I encourage you to wear masks, wear even the cloth-made ones that are out there if you prefer. Some people are wearing a surgical mask and then putting a cloth mask over that, so it looks so aesthetically nice, and they have this mask underneath. I've seen these masks made now that have a HEPA filter with a positive pressure pushed through, so that it actually pushes air into the mask. So in essence, even if it's leaking, the air is coming through and out. So it's a lot harder for environmental air to come through, then what you're relying on is the validity of that filtering system, that HEPA filter actually being legitimate, which I've yet to sort of be able to hone in and clarify, because I've done some of this research myself for some of these devices. But there's a range of things out there. So my trainer says the guidelines say to spray, but not to wipe the surfaces. So you could spray with an disinfectant, or try and use sort of like, an alcohol-based product. But again, the alcohol often, it's not designed for it. And my concern is that the alcohol will actually degrade the surgical mask itself. So you said that COVID is not spread by aerosol, then how's it spread? So there's different ways that COVID can be spread, that infections are spread. So there's surfaces, fomite transmission. We don't think that that's a large component of how it's spread. We think it's spread through respiratory. And then there's respiratory droplets and aerosol. And the difference between that is really the particle size. So aerosol is generated from deep in the lung, it coming from the actually alveoli at that lower lung level, and those come up into the atmosphere. A lot harder to have happen. Respiratory droplets come from the upper airway. Larger particles, you can even visually see some of them when someone's coughing or sneezing, and those are larger droplets. So if you're wearing a mask and you cough or sneeze, or you're speaking loudly or you're singing, and it hits the mask that you're wearing, it's protected by that mask and doesn't come out. That may be anywhere from 6 to 90% transmission. A lot of the studies show roughly 30 to 60% prevention of transmission, I should say. So it really cuts it down by 1/3 to 2/3, which is huge. And then distance, then those respiratory droplets don't travel very far. Aerosol can travel far because it's floating in the air, and depending on the wind, it can just travel. Whereas a respiratory droplet, larger, will drop because of gravity onto the ground. So it doesn't carry as far. So this particular virus is transmitted via respiratory droplet primarily, and therefore surgical masks work fine, even cloth masks work well because of that. Okay, another question is, how widespread is the problem of the sequelae among COVID survivors? How many recover totally? So we don't know the answer to that. It's a great question. That's what the research is actually starting to look at, is really what proportion of people. My sense of things is actually a fair minority, somewhere between 10 to 20% of people are having significant sequelae. I have a feeling it'll be more like 40 to 50% have some minor sequelae that then resolves within 6 months. But I have a feeling, my sense of things is that it's going to be more like 10 to 15% that are going to have significant long-term sequelae, which if you do the math on the millions of people infected, that's a large number of people. This is going to become a big issue. Imagine chronic fatigue now affecting millions and millions of people. So that's quite concerning, and that's what a lot of this research is going to be about. Again, the burden of the virus on the front side is really important on survival, as well as how ill you get. And I have a feeling it will start to prove out that the more mild the symptoms, the less of the sequelae you have, even though some people with mild cases are having it. I think the more severe the case, the more likelihood we're going to have problems. Well, wonderful. Any other questions before we close out today? Well, I appreciate everyone's time. We'll post this for those that weren't able to make it. We'll post this on YouTube. Feel free to share this. We have this live right now on Facebook as well. So you can go to our YouTube channel for those that want to see this again. In addition, we recently gave a nutrition talk, which we'll be posting as well on YouTube. So feel free to have a look at that as well. Thanks everyone for the time, and please stay safe and healthy out there. Take good care. Bye for now.